let's tickle your brain a bit with some real talk on COVID tests and why they're still tough to come by for many Americans. By now, you may know that there are many kinds of COVID tests out there. There are antibody tests that determine if you've ever had a COVID infection or vaccination. And then there are the two kinds of tests for active infections: a rapid antigen test that provides quicker results but is less sensitive, and the slower but generally more accurate PCR test. Rapid tests can be available in stores, but it may take a few stops before you find one. And when you do, you'll still have to pay up. At CVS, you could get one for $9.99. Other brands sold at pharmacies sell 2-packs for $23.99. Tests are about more than just simply telling you if you're positive. Rapid tests, especially, can be used in public spaces to limit COVID spread. Globally, we've seen rapid tests that provide results within 15 minutes used to stop asymptomatic carriers from entering schools, restaurants, and other public spaces. The White House has put more than $3 billion into increased access, but tests are still considerably more expensive here than abroad. That's because, unlike other countries, the US hasn't consistently used testing as a tool to fight the pandemic. The Biden administration has taken a different tack, and White House Press Secretary Jen Psaki even appeared a bit dismissive when asked about distributing free tests.
Why not just make them free and give them out and have them available everywhere?
Should we just send one to every American?
Our friends across the pond might say, yes. In the UK, you're allowed to order a pack of 7 COVID tests every day free of charge if your school or work isn't testing you. In Germany, tests aren't always free, but when you do have to pay up, it will cost less than $1 a test. And in India, you can order a reliable test on Amazon for under $4. The White House announced a new testing reimbursement plan earlier this month. It will allow people with insurance to get reimbursed for tests they pay for. But it's another burden for people getting tested. You're gonna have to spend more time on the phone with your healthcare company, get more paperwork ready, and navigate the bureaucracy of your insurance provider. And that's only if you qualify. If you have Medicare or Medicaid, it doesn't apply to you. The White House's plan makes 50 million tests available to Americans on those programs. It sounds like a lot, but Medicare and Medicaid cover more than 100 million people, meaning that it will be difficult for many people to use the large numbers of tests that other countries encourage individuals to use. Testing still has not become nearly as frequent as public health experts believe is required to contain the pandemic.